system collected blood from the lower part of the esophagus to entire part of the intestine to the most of the upper part of the rectum. This is all drained to the portal system. And then this blood collected from also from the spleen and to join the superior mesenteric vein to form the portal vein to enter the liver through the right and left portal veins. As you see from this animation, that the blood directed to the heart from the portal and to the rest of the body drain through the systemic venous system by the superior and inferior vena cava. So we either call this a systemic venous system or a caval system. يعني التسمية جاية from superior vena cava and the inferior vena cava. So the portal, systemic, or caval system. The circulatory system, usually it is continuous and close. And there is a connection between the portal and systemic circulation. Usually, the pressure between the two systems are equal. So there's no flow of blood between these two systems. And very, very little blood exchange between these two systems. اللي يهمنا حقيقة احنا هنا when there is an increase in the portal venous pressure, there is a flow of blood to the systemic circulation due to increased pressure in the portal venous system, and this lead to a complication. And the animation said that there is increase in the portal pressure and the blood will directed away from the liver to the systemic circulation اللي احنا نسميها the porto venous or porto cable shunts. As a result, as we mentioned, there is site احنا اللي احنا نسميها هي البورتو سيستميك انستموسيس اللي راح ناخذها بالمحاضرة اليوم ان شاء الله، واللي ايضا راح احتمال نشوفها هسه بالانيميشن. هاي هنا طبعا esophageal varices through the communication between the left gastric vein and azygous vein. Here, the esophageal varices, these communications, and caput medusae, and the biles. This is the normal flow of blood between the left gastric and azygous vein. There is usually very little exchange between these two systems. هنا عندنا صارت عندنا the uh, portal blood try to be sent to the cable system. As a result of that, there is dilatation of these veins either around the esophagus or in the lumen of the esophagus. نحاول نمشي بهذا الموضوع لأنه اليوم راح يعني نكمله. طبعا هو the most حقيقة dangerous complication of the portal hypertension هو esophageal varices and the bleeding of the esophageal varices اللي عادة هو يكون the cause of death in those patients. هنا طبعا الساينس طبعا والsymptoms of portal hypertension قد يكون هو the patient started with sign of anemia and the presence of tarry stool, black tarry stool as a result of upper GIT bleeding. طبعا هنا حسب ما هذه هنا it is a lethal condition if it is not treated and consider that the portal hypertension is the esophageal varices is a complication or a fatal complication of portal hypertension. هاي هنا طبعا كبت مدوزة كلكم تعرفوها. This is communication between the portal and subcutaneous veins around the umbilicus. هاي طبعا during the placental life or intrauterine life blood through the placental vein to the liver. This is obliterated after delivery طبعا when to form the round ligament of the liver and after development of portal hypertension, the flow of blood again through this obliterated vein to the subcutaneous area to form the caput medusae. هنا طبعا ligamental teres or round ligament of the liver. This is not transmitted any blood after delivery, and as a result of portal hypertension, there is recanalization and flow of blood to the area around the umbilicus to form the caput medusae. ايضا طبعا هنا other complication طبعا هو اكو portal cable communication in other areas بس احنا اللي يهمنا هاي الاسوفاجيال varices الكابت ميدوزي طبعا او الانوركتال varices. الانوركتال varices يعني usually it not produce خلينا نقول emergency bleeding or serious bleeding. كبت مدوزي أيضا، بس اللي يهمنا حقيقة هو الإسوفاجيال varices. هنا طبعا هو الكوميونيكيشن يصير عندنا between the superior rectal middle rectal vein. هاي نعتبرها احنا هاي البورتال and the inferior rectal vein هو السيستميك. ف communication between the superior rectal middle rectal vein and the inferior rectal veins. طبعا نفس الميكانيزم أيضا lead to flow of blood through this portal to the systemic circulation, producing internal hemorrhoids. And it is usually not painful and could be a source of chronic blood loss and bleeding. اوكي، هاي الانيميشن حقيقة يعني اللي شفتوها يعني مختصر البورتال هايبرتنشن. راح اشوف لكم فيلم اخر ممكن احنا نستفاد من عنده. طبعا هنا نرجع ايضا نفس تقريبا نفس الحكي مال الانيميشن السابق، بانه البورتال system هو drain blood from the most of the GIT system through the splenic and mesenteric vein communication in the portal system. Portal vein. طبعا البلد drained from the GIT contains all the nutrient absorbed from the GIT and also toxin, carry also toxin to the liver. الليفر يشتغل عندنا هنا detoxification of these substances absorbed from the GIT, which metabolize these toxins, which safely then excreted by the kidneys. Then the liver sent to the blood to the heart through the vena cava system. هنا بدي احكي على connection between the systemic and venous system. هاي الاريا اللي حكينا عنها اللي هي site of portosystemic communications. The inferior portion of the liver, عفوا inferior portion of the esophagus, and the superior portion of the anal canal مثل ما قلنا between superior middle rectal vein and inferior rectal vein, and the area of the round ligament of the liver. احنا هو placental vein, obliterated placental vein. This is the round ligament after the birth. When the pressure of the portal system rise above the 12 millimeter mercury, the portosystemic shunts form. Okay, so when there is portal hypertension, the amount of the blood delivered to the liver will be less. So there is a decrease in the liver function and decrease of blood detoxification. Okay, and then build up of these toxic materials like ammonia, and these toxins will pass to the systemic circulation, and then it passes to the blood-brain barrier and producing hepatic encephalopathy or encephalopathy. Then احنا اللي سميناه بورتو or بورتو cable or بورتو systemic communications. This is the esophageal varices. So, and these varices are fragile, easy rupture, and cause massive upper GIT bleeding. Also, this is in the rectum and anal canal, piles or hemorrhoids, which enlarge veins in this area, which could give rise to bleeding. Rechannelization of the round ligament, which pass to the systemic system, venous system, and due to dilatation of the veins around the umbilicus, producing carbotomodosine.
Meaning the
also blood will be backflow to the spleen, producing splenomegaly and then producing hypersplenism, which impair the function of the spleen, producing anemia and leukopenia. Or platelets اللي احنا نسميها reduction of the number of platelets, thrombocytopenia اللي احنا كلها هنا نقدر نسميها pancytopenia. And also as a result of portal hypertension, lead to endothelial cells producing or releasing more nitric oxide, lead to dilatation of the arteries, and increase the blood pressure will drop, and then طبعا هاي mechanism of ascites in cases of portal hypertension. على العموم آخر نص ساعة راح نكمل وياكم يعني clinical cases. قبل هذا راح أشوفكم أيضا one of the complication of portal hypertension والesophageal varices and the management of these varices. طبعا هاي الأفلام أعتقد ما راح نلحق، يعني راح أعطيكم الأشياء المهمة فقط. طبعا هذا patient عمره 37 years with portal hypertension and bleeding esophageal varices. تسمعوني تمام؟
واضح دكتور.
اوكي. هذا مريض عمره 37 سنة with portal hypertension and bleeding esophageal varices. طبعا one of the modalities of treatment of esophageal varices هو variceal sclerotherapy. اوكي. هذا المريض presented with massive bleeding, hematemesis, and malignant. The patient lost about 1.5 liters of blood, was then replaced by 2 pints of packed red cells. After stabilization of the patient, we proceed for sclerotherapy. And also resuscitated by somatostatin infusion. هذه أيضا راح ناخذها اليوم بالمحاضرة. And once the patient stabilization, طبعا هنا تشوفون هنا اكو stigmatas of recent bleeding. Which begins around 30 centimeters from incisor teeth. These share red spots, which is stigmata هذا تشوفوه هنا. Share red spots, which is considered as a stigmata of recent bleeding. طبعا esophageal injection عندنا هنا اما intravaricial injection or paravariceal injection او نستخدم الcombination. Usually we start with the paravariceal and then proceed to esophageal injection. No, it is a sclerotherapy. Normal saline حقيقة يعني هو ممكن بس sclerotherapy produce thrombosis of these veins تشوفون يعني once it injected there is a thrombosis and coagulation of blood inside these veins, and the bleeding تشوفون هنا ما عندنا any bleeding which indicate successful of this procedure. طبعا هاي one of the modalities of treating bleeding esophageal varices. أيضا فيلم آخر one of the ways of treating of portal hypertension أو complication of portal hypertension احنا نسميها التبس. هو transjugular intrahepatic transjugular من اسمه through the jugular or internal jugular vein intrahepatic portosystemic shunting. خلينا نشوفها هسه هاي اللي احنا نسميها TIPS transjugular intrahepatic portosystemic shunting. These are symptoms of portal hypertension اللي هي variceal bleeding, ascites اللي إن شاء الله اليوم راح ناخذها بالمحاضرة and how to treat ascites, encephalopathy and hyperspilenism. اوكي اللي احنا قلناها هي anemia, leukopenia, and thrombocytopenia. So as a result of rise pressure in the portal system, there is a direction of blood and producing through the lower esophagus, through the inferior, through the left gastric vein, through which communicate with the azygous vein, producing the esophageal varices. And ده تشوفون هنا the pressure rises here. When it rises above 20, which is the pressure when these varices started to bleed. So to divert blood away from the esophagus or to reducing pressure in the portal system, we use the procedure اللي هي مثل ما قلنا transjugular through the internal jugular vein. طبعا هاي جماعة الانترفيشنال راديولوجي هم اللي يسووها. Small incision through that vein, and the catheter will introduced through the internal jugular vein through a guide wire into right hepatic vein. عرفتوا؟ يعني through the internal jugular guide wire will be passed to the right hepatic vein اللي هو طبعا hepatic vein. Then at that time we introduce a catheter and balloon to measure the pressure inside the portal system. Then we pass a long needle through the liver to a major branch of the portal vein. Okay. Then venogram performed to ensure that we are inside the portal system. Then we remove the needle and also we measure pressure again, and we introduce balloon catheter to dilate these tracts between the hepatic and portal vein, and sheath advance and introduction of stent to open the stent between the portal vein and the hepatic vein. Then we check the pressure and show the pressure will be reduced. طبعا this is an effective way to reduce pressure and prevent variceal bleeding. Okay. طبعا this is now is commonly used طبعا بال very equipped center or tertiary centers. Okay. احاول هسه راح اعطيكم كم سلايد على يفيدكم أيضا بالامتحان مال باكر. أتمنى الكل يعني يشارك، لأن راح أسأل الجميع. احنا بقالنا تقريبا 20 دقيقة، لاحظت لكم إياه أيضا. أوكي، أنتم باكر إن شاء الله احتمال حتجيكم سلايدات يعني بالأوسكي. أوسكي باكر مو أعتقد عندكم محطات أيضا. هنا صورة تشوفوها، راح أسألكم طبعا what is the examiner trying to demonstrate in this case؟ من يجاوبني؟ شنو؟ No. What is the examiner trying to demonstrate؟ من يجاوب؟ Yes, yes. هو
يعني الجوانب لو سكروتال غير دكتور؟
هاي لا، هو هاي هنايا. What is the examiner try to demonstrate whether he could get above the swelling or not؟ صح؟ زين. What are the differential diagnoses؟
سكروتال هيرني.
بالضبط. يعني هنا the patient if he could get above it or not، هنا عندنا differential diagnosis. He trying to get above the scrotal lump. Differential diagnosis inguinal or inguinoscrotal hernias. inguinoscrotal hernia يعني or hydrocele اللي patient could get above the العفو could get above the swelling, testicular tumor or varicocele. يعني this is a differential diagnosis of scrotal swelling. اوكي، خلوها ببالكم. طبعا احنا مرات تجيكم اسئله بالامتحان يقول لك spot diagnosis. يعني شنو spot diagnosis؟ once you see حقيقه without examination، بس مجرد ما تشوف الليجن you could or you give diagnosis. Spot diagnosis, and what physical signs would you elicit to confirm the diagnosis؟ هاي هنا spot diagnosis شنو هنا؟
ganglion cyst.
Very good, ganglion. Okay. What physical signs would you elicit to confirm the diagnosis؟ شنو الفيزيكال sign ممكن؟ Trans illumination. بعد
fluctuation.
Very good. شنو الماتيريال اللي ممكن seen within the cyst؟ Good. Gelatinous material, a soft fluctuant mass with trans illumination, and there is no punctum. هذا شيء مهم. إذا لقينا بها punctum، يعني شنو punctum؟
سبيشيس.
It's just like yeah.
Yes, sebaceous. Very good. Presence of gelatinous material containing mainly hyaluronic acid and lesser amount of glucosamine, globulin and albumin. هاي
دكتور
نعم. يعني
بالسلايد اللي قبله نقدر نقول بس synovial fluid لا يختلف؟
synovial ممكن يعني هي طالعة من الساينوفيال ممبرين، يعني ممكن synovial joints، بس يعني نقدر يعني هو المادة هنا يعني جيلاتينس ماتيريال اللي تحتوي على هاي المواد. هاي السبوت دايجنوسيس.
نيكولايسيس.
شنو؟ Good. There are two pathological processes here. What are they and how do they interrelated? شنو الباثولوجي هنا عندنا؟ طبعا هنا هي not uncommon هو ingrowing toenail. Okay, with inflammation. Patient عمرها 34 سنة has this pigmented lesion in this site. تشوفوها. شنو هاي ممكن؟
multiple myeloma.
لا
بابلوما
ميلانوما ميلانوما or خلينا نكون عبارتنا أوضح. It is a nevi, pigmented nevi. Okay. شو وقت نقدر نقول هاي النيفاي dangerous and what are the indication of removal of these nevi? Very good. Very good. Change in the or recent change in these nevi. Okay. When there is bleeding, itching, increase in size, shape, thickness, changing in color مثل ما قلتوا, bleeding, ulceration, and presence of a large lymph node. This an indication of transformation into a malignancy. What is the most likely diagnosis? And what
لايبوما
physical signs you have expected to find on examination of the lump? بعد منه عندنا اقتراح آخر. ممكن axillary tail. اوكي بس هاي شكلها اللي قال لايبوما هو صحيح. Very good. زين. It is a soft. طبعا how do you بالexamination signs it is a soft fluctuant feeling lobulation كلش مهم باللايبوما. and شيء أيضا آخر مهم هو free mobility of skin overlying يعني it is not attached to the skin with a characteristic slippage sign which طبعا contrary to the sebaceous cyst اللي هي قد تكون attached أو attached to the skin and we cannot move the skin over it and usually the skin over it هو يكون normal. ما عندنا مشكلة هنا بالسكن. Okay. The sites where subcutaneous lipoma never occur. وين تتوقعون؟ ممكن صحيح. Very rarely these tumors are malignant. What clinical sign very rarely these tumors are malignant. What clinical feature would suggest malignancy? وين السايت اللي احنا نخاف منها مرات اللايبوما تكون malignant؟ طبعا very rare طبعا بس اكو سايت احنا تكون more prone to be malignant. من يعرف؟ ماكو. مرات احنا اللايبوما بالباك ريتروبريتونيال اوكي لايبوماس يصير عندنا لايبوساركوماس. هاي شنو السلايد؟
varicose vein
very good. varicose vein. هيك ما اعتقد يجيبوا لكم اياها. الان what is the investigation done here?
barium swallow.
Barium swallow, very good. This patient got weight loss. There is no pain. What is the physical sign seen here?
jaundice.
Very good,
Jaundice.
jaundice. What do you expect the stool color will be and why?
pale.
Pale color, صح. سامعين الكوربوزير لو؟ شنو الكوربوزير لو؟ palpable in patient دقيقة in patient with jaundice مو صحيح؟ with palpable gallbladder. It indicates presence of malignancy rather presence of stone. مو صحيح؟ إذا patient عنده stone طبعا هاي باي physical examination إذا تخلي إيدك على الأبدومن وتحس أكو globular mass اللي هي gallbladder patient عنده painless jaundice it indicates malignancy. اوكي ليش يصير عندنا دايليتيشن بالجول بلادر بالمالجنسي ما يصير عندنا بالجول ستونز طبعا هو ممكن ايضا يصير بالجول ستون بس بالمالجنسي مور ليش لا هو يعني either pressure from inside or pressure from outside صحيح it indicate tumor of the pancreas usually يكون الجول بلادر هو healthy and it will easily distensible تكون يعني يصير بها distension لأنه الwall usually healthy but in case of gallstones and there is a recurrent attack of cholecystitis يكون الwall very fibrous and the gallbladder will not be palpable. Okay, and it is a painless. طبعا what additional investigation should be done in those cases على السريع خاطر نلحق
دكتور ميرفي ساين و
لا physical investigation not an examination ها بابا لا انتم دائما بالinvestigation you have to start with the symbol شنو السيمبل هنا عندنا blood test طبعا اول شيء انتم تبدون دائما شوفوا بالانفستيجيشن تبدون اول شيء بالبلاد مو صحيح نبدي blood investigation يعني complete blood picture اذا اكو hemolysis or not يبين anemia white BC high lymphocyte اوكي بعدين ممكن نروح على liver function test كلش مهمه شوفوا TSB whether an elevation of direct or indirect elevation of bilirubin نشوف الليفر فانكشن تيست ايضا مهمه عندنا alkaline phosphatase usually high in those patient ايضا blood urea nitrogen مهم بالاضافه الى الفيرولوجي and then we proceed to the radiological or imaging احنا كلها ناخذها اللي هو اهم واحد عندنا and the simple bedside ممكن available اللي هو الالتراساوند طبعا يشوفنا there is a dilatation بالbiliary system either intrahepatic extrahepatic dilatation with the distension of the gallbladder ايضا ممكن يشوفنا اذا اكو ماس يشوفنا ستون هاي الالتراساوند then CT scan MRI كلش مهم عندنا بالجوندس magnetic resonance imaging these all طبعا مرات حتى نحتاج بحالات يعني ناخذ fine needle aspiration from the mass or from the liver. اوكي تبقى لكم 5 دقائق اعتقد راح احط لكم اياها هاي السلايدات تقريبا عندي هنا 80 سلايد بس ما صار الوقت المناسب بانه نشرح عليها. اوكي ان شاء الله اليوم نلتقي الساعه 12 نكمل موضوع البورتال هايبرتنشن. لا هاي ما تنزل، هاي نتناقش بيها لانه بس تنزل بعد ما راح يعني ما راح يصير، ما راح تفكرون بالموضوع. اوكي ثانك يو.